So please keep in mind that the CDC guidelines, again, are for fabric that you have at home over your face, not necessarily for those medical masks.
And now we don't make any judgment on anybody who has these masks already in your home, as you may have them in your home for many other reasons.
So for those of you who are actually wearing those masks or the fabric at home, we are going to talk about the different kinds and how effective they are.
And we're going to talk about 3 different types of protection. Number 1, the respirators. Number 2, the surgical masks. And number 3, the fabric or cloth masks.
So to start with, we are going to talk about respirators. One of the types that we're going to talk about is something called a P100.
It's called a P100 because it filters out 100% of particulate matter during inhalation. As you can see, it has a silicone base that makes it really comfortable to wear, and it has these pink cartridges, which can last for an extended period of time of up to 40 hours of wear and keep you protected. It's typically used by cancer patients to protect them from bacteria and viruses in the air, but it's also used by construction workers for when they're working with asbestos or when they're building. The next type of respirator is an N95.
This is going to be one of the most common ones that you're going to see our healthcare workers using. Similarly to the P100, it is going to have a tight fit around the face and filter 95% of the particles that we are inhaling. Now, importantly, there are multiple sizes of this mask. This is going to be actually governed by the National Institute for Occupational Safety and Health.
What that means is that every healthcare professional is specifically fitted for these masks so that we know that they're protecting us appropriately.
So when healthcare workers are wearing these, it's most important when we're around infected patients, because if we're within a 3-foot radius of someone who is actively sick and coughing on us, it's going to protect us with that extremely tight fit that we know has been approved by a governing body.
The second type of protection is a surgical mask.
These are loose-fitting masks whose main purpose is to create a physical barrier between whoever is wearing them, the nose and the mouth, and the environment around them.
Surgical masks may also reduce the exposure of your respiratory secretions and your saliva when you cough or sneeze or when you exhale.
So let's talk about the effectiveness of protection, as in each mask that you wear, how much does it actually protect you from being infected by this virus? So if fitted properly, an N95 is up to 95% effective.
Now the surgical mask, on the other hand, is 33 to 50% effective.
Once we put these on, you can see that the fabric is much flimsier, it has a different filtering capacity, and there's gaps along the edges.
Now, the third type of protection are the bandanas that the CDC is asking everyone to wear.
These have only been shown to be between 3 and 11% effective in filtering things out when you are breathing in.
Now, the reason that the CDC is asking us to wear these while we're in public is actually to protect others from our particulate matter.
A few studies are coming out of China and Iceland showing that 25 to 50% of people being infected in the community are actually because of silent infections. That means that people are unknowingly spreading this virus without having any symptoms.
So wearing the mask helps you protect others from your potential viral infection.
But it's going to take everyone really actually participating in this to even hypothetically help. I urge all of you to be very cautious as a blanket statement with a lot of the social media and infographics that are out there regarding the actual efficacy of surgical masks, because some of those sites are actually stating that they're 97% effective, and we know in comparison to N95s, they've got a lot of gaps, they have flimsier fabrics, they are just not going to be as effective.
An N95 mask is, by definition, 95% effective at filtering particulate matter that is airborne. If you remember our rock from earlier, so less than 5 microns in size. And as you can see, it's tightly fitted, so the particle doesn't get in.
So logically, if something has gaps in it, those small particles are going to go in much easier with no difficulty. So please be cautious on those statements.